If you are living with IgG4-related disease, then you already know the cycle. It's that constant, nagging fear of a relapse. That feeling that, even after treatment, the inflammation and the damage could come roaring back. But what if that cycle could actually be broken? What if there was a way to escape? Today, we're diving into a breakthrough that is fundamentally changing the game for people with IgG4-RD.
And it really all boils down to this one incredible number: 87%. Now, let's be clear. This isn't some small, incremental improvement. This is a massive, seismic shift. This number represents an 87% reduction in the risk of having a painful, damaging disease flare-up.
So, okay, a number that huge, it demands an explanation, right? You have to ask, how is that even possible? Well, that's exactly what we're going to do. We're going to unpack the story behind this statistic, the science, the trial, and what it really means to finally get out of that relapse trap.
So where did this game-changing number come from? Well, this isn't just some hopeful estimate they pulled out of thin air. It comes from the highest standard of medical proof we have, a huge clinical study called the MITIGTE trial. And honestly, this is the trial that has changed everything.
Okay, just look at this chart. The difference is really night and day. Over on the right, you've got the group that received a placebo. Nearly 60% of them, a huge majority, had a flare-up within a year. Now look to the left. For patients taking UPLIZNA, that number plummets to just over 10%. The difference is just staggering.
You know, let me put that a different way, because sometimes simple comparisons hit harder. Just think about this. For every 6 people in the trial who suffered a relapse while on a placebo, only a single person on UPLIZNA did. 6 to 1. That's a powerful way to see just how effective this treatment really is.
And the good news just kept coming. It wasn't just about stopping the flares, it was about actually getting people into remission. Over half the patients on UPLIZNA achieved complete flare-free remission. And maybe even more importantly, look at this. Almost 60% were able to get off steroids completely, finally escaping all the side effects that come with them. That's more than double what you see in the placebo group. It's a huge deal.
Okay, so we've seen the proof. It works, and it works incredibly well. But the next big question is, how? How does UPLIZNA actually pull this off? Well, to get that, we need to look at what's causing the problem in the first place.
It all starts right here, with a type of immune cell called a B cell. You can think of these guys as your body's little antibody factories. Normally, they're crucial for fighting infections, but in IgG4-RD, a bunch of them basically go rogue. They start pumping out these harmful antibodies that drive all the inflammation and fibrosis. That's the scarring that does permanent damage to organs.
Now, older treatments like rituximab were a step in the right direction. They also went after B cells by targeting a marker on their surface called CD20. But here's the catch. It had a blind spot. It missed a really important group of troublemakers called plasmablasts. UPLIZNA, on the other hand, targets a totally different marker called CD19. And the key is, CD19 is found on the entire B cell family, including those sneaky plasmablasts. It's just a much more comprehensive way to shut down the problem.
The way it works is actually pretty clever. So first, UPLIZNA finds and latches on to that CD19 marker on the rogue B cells. Then, by attaching to it, it basically puts up a giant red flag that says, "Hey, destroy me." After that, your body's own immune system sees that flag and comes in to eliminate the cell. And the end result? The factories causing all the trouble are shut down, and the harmful inflammation and damage finally get stopped in their tracks.
So now that we see how the solution works, let's just take a moment to really appreciate how bad the problem was. Because this wasn't just about finding a slightly better drug, it was about finding a real escape from a truly devastating trap.
Before this, the main weapon in the arsenal was high-dose steroids. But just look at this number. Up to 60% of people would relapse within a single year. Imagine that. You go through the treatment, you start to feel better, and then for the majority of people, the disease comes right back. It's just a crushing cycle.
And every single one of those relapses is more than just a setback. It causes progressive and often irreversible organ damage. It means you're living under this constant psychological cloud, just waiting for the next flare-up. And we now know that the chronic inflammation from this disease is linked to a more than 2-fold increased risk of certain cancers. So stopping the relapses, it is absolutely critical.
This chart here tells the whole story of treatment progress. That massive 60% slice, that was the reality on steroids alone.
Then came rituximab, a huge step forward that cut the risk down to about 35%. But UPLIZNA, that's another massive leap, shrinking that relapse risk all the way down to that tiny 10% slice. You can literally see the hope growing with each new therapy.
Okay, so we've seen the data, we've gone through the science, let's bring it all home. What does this breakthrough actually mean in practical terms for you or your loved ones?
So, here's the scoop. UPLIZNA is officially FDA approved for adults dealing with IgG4-related disease. Now, before starting, there are a couple of routine screenings your doctor will do for things like hepatitis B and tuberculosis, which is pretty standard for this class of medication.
And the dosing schedule is actually really straightforward. It starts with one IV infusion, then you get a second one 2 weeks later to really get things under control. And after that, it's just a single maintenance infusion once every 6 months. That's it, twice a year to keep the disease in check.
Of course, with any powerful medicine, we have to talk about safety. The most common side effects seen in the big trial were things like urinary tract infections, or a temporary drop in some white blood cells. A small number of people had a mild reaction during their infusion, but this was pretty uncommon. It's a safety profile that doctors are well equipped to manage, especially when you weigh it against the dangers of uncontrolled disease or long-term steroid use.
So it really makes you wonder, after all these years of dealing with such a relentless disease, are we looking at the dawn of a new era? An era where long-term steroid-free remission isn't just a distant hope anymore, but an achievable reality for people living with IgG4-RD? Based on everything we've seen today, the answer seems to be a very hopeful yes.